All right, we are back with another episode of Florida Kids Therapy Services where we put Jessica Otto, the owner, in the hot seat and ask her all the things that maybe clinical fellows, SLPs, SLPAs are thinking but may not feel comfortable to ask. How's it going, Jessica?
Good. How are you, Jen?
I'm doing good. All right, I want to ask you a burning question. We've been asked this before in our interviews. And so, my question for you is when you get a candidate who talks to you about how it might be a little bit too loud in the schools and maybe ways to navigate how loud it is in the schools and working with multiple students at time like at a time and working in the school system in general, what do you tell them?
So the schools are their own beast as far as settings. And I love the schools. I've served in schools a number of years. And I love the schools because of their flexibility, their unpredictability, the chaos,
Mm,
the noise. Those things to me are enjoyable, even. And I can look back at my life. I'm the oldest of four kids. I had a friend
mm,
who was an only child, and she used to say she was coming to our house to watch the circus because there was a circus at our house all the time. And so there's a piece of me that was raised with just so much going on all the time. So for me to be
mm,
in a school professionally and there's teachers all over the place and some things don't happen on time and there's noise and there's lots of kids and there's lots of needs, that doesn't bother me. Even in a professional setting, that actually levels me out. And I know that sounds very strange, but it is a very comforting and familiar and easy environment for me to be in. My hardest days are when we go do training and I have to sit somewhere for 6 hours. That's my worst nightmare. And we make it through about 3 hours, and I'm like, oh my gosh, can this please be over? But I do feel like it's important to address a couple of school factors that are probably present in 95% of schools. And
mm,
one is a high noise level given at any time. You have kids screaming, you have kids going through the hallways, you have things happening that are out of your control, and they can be in your therapy space, they can be next to your therapy space. So, high noise level is very significant. Schedule changes can happen all the time. You're always changing your own schedule, accommodating your schedule around other people. Um, and then there's the school factor of truthfully only getting paid for 70% of the year. So to me,
mm,
those are really big factors of you have to be okay with those factors. If you don't like noise, the school is not a good place for you. If you
sure.
don't like the potential that your job is going to change every day, that you walk in and there's going to be a new factor you've never thought about or heard of, the school is not a good fit for you. And if you need to get paid year round full pay, then the school is not a good fit for you.
Do you feel like, when you were in school, you were prepared for that? Did your teachers give you any warnings about what that was gonna look like, and did they ever talk about noise? Because I feel like that's one thing that, people don't really talk about is how loud it is in the schools, right? I've gone to my kids' schools before in lunch and handed out Halloween treats, and I'm like, "Here's 3 Advil." So, do they talk to you about it? Do they warn you?
I did have a professor who talked a lot about the home setting. And in that sense, she really normalized the factors of different settings. And so, honestly, I'm actually sure that she did discuss a school setting as well, because I remember her talking about a nursing home setting. I remember her talking about a home setting and some of the extraneous factors. Like in a home, you're in somebody's home. You don't know who's coming in the door. You're in a neighborhood. If you're in a neighborhood that is challenging or dangerous, like those are factors and those become important. And I remember her talking about a nursing home and even talking about the smells of many nursing homes that was talked about in graduate school. So I'm sure, truthfully, that she talked about a school. I also did internships even during undergrad in schools. And for me, that was very normalized. But I have interviewed and interacted with therapists who have never done a school placement before until they, get pretty far into graduate school. And it can be a lot. So trying to be aware of the extraneous factors that can be highly, what's the word, like create a different level of pressure in that school environment, I think is really good. And there are other environments that we serve in that are so good if you like quiet. Like nursing homes are quiet. They're year round. Hospitals can be loud, can be quiet, but hospitals also bring their own intensity that, like, if you enjoy the intensity, a hospital can be a great setting for you. You're working really closely with other colleagues and with families, but they tend to be very emotionally heavy. Knowing where you're in and out of, if you like working with adults, then a nursing home can be a great environment. And then private practice is a very known environment. You sometimes will have a loud patient, but in general, you're not dealing with super noisy settings all day long, and you only see patients one on one.
That's awesome. My one question for you was going to be, well, what do you tell somebody and where do you recommend? So I love how you gave the examples of working in a hospital setting, working in private practice, and working at home, and some of the factors that they didn't consider. So if you are listening to this video and you're thinking, maybe I want to work in a school system, let's factor in for the noise.
Yes, for sure.